Hi, this is Dr. David Tener. We're here at the Goldberg Tener Clinic, just outside of Atlanta, where we specialize in reversing chronic disease. Today, I'm joined by Lindsay Coxell from California.
Yep.
She flew in today for her re-exam, and she's done wonderfully, and she's going to tell her story. So, Lindsay, tell our audience a little bit about what brought you in originally and what type of problem you were having.
Sure. So after having our first child in 2019, I had some joint pain that just kept continuing on, visited a rheumatologist, was diagnosed with rheumatoid arthritis, which was a huge surprise because I've always been, I thought, active, healthy, lived a pretty healthy lifestyle. And so since then, I've kind of been on a journey to figure out the root cause. The rheumatologist told me that it wasn't my fault and just to take this medication forever, and we could just manage my symptoms that way. But I just knew that there had to be a better answer and that wasn't how I was going to live.
Sure, yeah, the course medically is fairly predictable.
Yeah.
The patient has joint pain, swelling, then they see a rheumatologist. Lab work shows some indicators of autoimmune disease, perhaps inflammatory markers are high or different antibody levels or rheumatoid factor. And then there's just a handful of drugs that are basically given out to suppress the immune system. And unfortunately for most patients, that's really it. That's the course that occurs, and the patient's symptoms will just get managed with drugs for the rest of their life while they continue to deteriorate. Pretty gloomy outlook, actually, and it kind of takes control away from the patient to feel like they can do anything about their situation. But Lindsay's outcome here is a great example of what's possible.
Yeah.
And so rather than treat disease, we work to dissect out the specific reasons why the person became ill. Because at one point in your life, you didn't have this problem.
Right.
You were healthy.
Yeah.
So there's some set of factors that led to this, and that's what we needed to identify. And we certainly did a good evaluation. We were able to narrow those things down, and then developed a course of action for Lindsay to rebuild her health, so she could take control of her situation. And Lindsay's been an excellent patient. She's done very well. When you were at your worst, though, Lindsay, what were your symptoms like? I think you had mentioned you couldn't open a jar.
Yeah.
Tell us a little bit about what life was like at that time.
Woke up with bad joint pain in my hands, my feet, sometimes in my knees. Opening a jar was hard. My wedding ring didn't fit, and so.
And this was tough because you're a mother, you have kids.
Yeah.
And
that was with a newborn, so I was waking up in the middle of the night to breastfeed, and it was.
Yeah, tough existence.
Yeah.
Yeah. So Lindsay's worked hard with me over the last several months. We've implemented a good program. And how are we doing now?
Very well. So I had another part of the journey was a root canal that was infected.
Mm-hmm.
That has been now removed by a biological dentist. And so that was in March. So I stopped my medication. I stopped taking Cimzia in February.
And how long have you been on that for?
Almost 3 years.
3 years of Cimzia, which is a strong biologic that has potential for some pretty serious side effects. And one of Lindsay's goals was to not be dependent on that in the future. You're also on Plaquenil.
Yes.
Okay. Are you taking any drugs currently?
No.
Okay. And how are your joints doing?
Good. So I feel great. My rings are back on.
Lindsay did a grip test for us today, and her grip strength was excellent. I mean, she shook my hand, almost broke my hand today. It's pretty good. Yeah, not bad for someone who's been diagnosed with rheumatoid arthritis and told you there's nothing you can do about it.
Yeah.
So her grip strength on both sides was about 30 kilograms of pressure, which for a girl, that's pretty good.
Yeah, it's
pretty strong. Yeah. So Lindsay's health is better, your digestive function's doing better, is your energy good?
Yeah, energy feels good.
Her weight is excellent, her BMI is right in the normal range, her body fat percentage is good. I mean, she's really the picture of health. So from a gloomy outlook of being crippled with rheumatoid arthritis the rest of your life and on drugs, to now being an excellent health and drug-free is quite an excellent outcome. We're thrilled about that. And Lindsay's story and her achievements here are an excellent example of what's possible if we can get down to the causes, address them, and then rebuild health.
Yeah.